Hello, my name is Chelsea Robertson, and I chose to do my transcultural nursing presentation on the Mexican American culture. The purpose of my presentation is to understand the Mexican American population as well as the nursing care that should be provided across the lifespan to provide individualized, culturally sensitive care. Mexican Americans are the largest and fastest growing minority group in the United States. According to the CDC and U.S. Census Bureau, there are about 54 million Hispanics that live in the United States, which makes up about 17% of the total population, making Hispanics the largest minority group in the nation. Within the Hispanic population, there are many subgroups, and Mexican Americans are the largest of the Hispanic subgroups, which as of 2012 was ranked at 64%. Religious beliefs greatly influence how one culture defines health and illness, as well as determine their beliefs and values related to healthcare. The Mexican American culture is primarily Roman Catholic. The Mexican American culture believes that God's will has control over everything, and it is God's will that determines one's health status. Illness is viewed as punishment from God for their behaviors. Mexican Americans also believe in the hot and cold theory, and that an illness can be caused by an imbalance. However, the imbalance is not due to temperature, but the temperature relates to and is defined by the disease. The classification of disease has been passed down from one generation to the next. Folk remedies of Mexican Americans are derived from the influences of Roman Catholic Church and the Mexican Indians, and include herbal remedies, use of amulets, and rituals performed by folk practitioners. Shrines, medals, candles, prayers, and healers are commonly used in their religious practices. Many Mexican Americans use traditional medicine, however, few tell their healthcare providers. A study was conducted that concluded 75% of Mexican Americans use alternative therapies and traditional remedies to treat their illnesses. Curandesimo is related to spirituality and is the practice of maintaining harmony and balance within nature, and some curanderos or traditional healers have specialties within the physical, mental, emotional, and spiritual state in which they diagnose health problems and cure these illnesses. Remedies are frequently used and are commonly recommended by curanderos, and they may also recommend a special diet. Herbs as well as plants are used within the Mexican American daily diet and are commonly used when cooking. Nursing care for childbearing women. During pregnancy, Hispanics may use their family or social network, such as their grandmother or another maternal relative, as their primary support and advisor. It is essential for nurses to complete a cultural assessment to evaluate the use of non-traditional support versus Western healthcare during her pregnancy. Having a support system during pregnancy has shown to reduce labor pains, reduce stress, shorten labor duration, less pain medication use, increased satisfaction, and positive attitude about becoming a mother. Other cultural beliefs include remaining happy during pregnancy will bring the baby joy and good fortune. Sleeping in a supine position will protect the baby. For a small baby and easy delivery, it is important to remain active during pregnancy, and wearing a muñeco will ensure a safe delivery and will also prevent morning sickness. Nurses must also show respect when providing care, and this can be achieved in the Mexican American culture by locating religious advisors, allowing time for prayer or meditation if needed, addressing the patient by their last name, incorporating and acknowledging elder guidance, respecting that the male figure may be the final decision maker and will be the protector during pregnancy, as well as encouraging the patient to have her spouse participate at prenatal visits. With regard to the Mexican American hot and cold theory, it is believed that pregnancy is a hot state, and once the delivery of the baby has happened, it is believed that a lot of heat is lost from the mother. Therefore, the patient may prefer room temperature water, warm tea, or coffee. Instead of using ice packs and sitz baths, heat lamps, heat packs, and anesthetic topic agents could be used to avoid cold temperatures as well as promote healing. Nursing care for children. According to the U.S. Census Bureau, 73.8 million children live in the United States, and 15% of these children are Hispanic. The number of Hispanic children has increased faster than any other group. During hospitalization for a child, it is important to foster the environment to closely resemble their home and routines. Recovery could be improved by having familiar foods. Therefore, it is important for nurses to assess the child's eating habits in relation to their culture. It is also important to encourage family members to be present, especially during mealtime, and bring meals from home if appropriate. Determining a child's bedtime routine is also important and should be continued while the child is at the hospital. Common bedtime routines may include a bedtime snack, prayer, having a favorite toy, or favorite story told before bedtime. Nurses should understand that cultural beliefs also influence how menstruation is viewed, and that folk remedies may be used during this time to help with symptoms. For example, Mexican American girls should not walk barefooted, wash their hair, or take showers during menses. As a nurse, it is our job to encourage sponge bath and frequently changes of pads or tampons, to name a few. Nurses should respect the girl's preference during menstruation and provide the teenager with what supplies are needed during this time. Herbs and home remedies may also be used to help with cramping. It is important to ask if any remedies or herbs are used to make sure there are no interactions with conventional medications. It is also important to allow teenagers to wear their own clothes while in the hospital to maintain the patient's identity. During a child's sickness, the child's mother may take him or her to a doctor, as well as a curandero, who is a traditional healer. The mother may also consult with her mother before giving the child any medication to determine what she believes will help the child the most. The mother may use both recommendations from the physician as well as the traditional healer. If parents strongly support the traditional beliefs, then the nurse should respect their choices. During hospitalization, the Mexican American family may want to have an amulet, talisman, crucifix, or rosary near the bedside. The Mexican American culture also believes that having chronic disease and disability can be a positive reward from God. Mexican Americans believe that there are a certain number of chronically ill children that are supposed to be in the world, and parents of a chronically ill child and who practice Roman Catholicism believe that God has made them the child's parent because of their kindness to someone near to them who is also disabled. Bruce and Boyle 2012 state that cultural assessment is the foundation of excellent transcultural care and cannot be overlooked even in the face of major obstacles. It must become an integral part of the admission assessment of all children and adolescents, thus enabling excellent individualized, family-centered care. Nursing care for adults. Achieving success in one's career is a developmental transition, which may be difficult for immigrants. Obtaining a good job may be difficult in the United States because of language barriers and educational requirements. For Hispanics, emphasis is placed on maintaining the extended family. Even after a couple gets married, they still may live with their family. It is also known that Hispanics are reluctant to allow their daughters to leave the home until they are married. Mexican Americans receive support from both their nuclear and extended family on a daily basis as well as during crisis. The family as a whole will make decisions regarding individual health care. During aging, women go through menopause, and how women respond to menopause is determined by their cultural beliefs. Mexican American women may use folk medicine to help with symptoms of menopause. Nursing care for older adults. In 2008, it was determined that 20% of the older population over the age of 65 were minorities, and of these minorities, 7% were from the Hispanic population. It has also been determined that some racial and ethnic groups are more prone to certain health conditions. The Hispanic population has a higher risk for congestive heart failure, cardiovascular disease, as well as diabetes. More hospitalizations occur within this group because of health disparities. These disparities exist for interrelated reasons, including lower income levels, lack of insurance, including barriers to Medicare, barriers in access to care, and lower quality of care from some health conditions even when the individual is insured and care is received. Within the Hispanic population, 40% do not have a private retirement plan, and 20% have incomes that are lower than the poverty level, indicating Hispanics have limited care options as they age because of how costly long-term care can be. Nurses need to be able to assess the patient's situation and level of care needs in order to help get funds to care for the elderly population. Culture influences how a person defines illness and will influence if the patient will use traditional, conventional, or both sources for care. Mexican American elderly population is twice as likely to use traditional methods than any other cultural groups. Nurses can can show culturally sensitive care by asking and incorporating the patient's use of traditional practices into their plan of care as long as it is appropriate and safe for the patient. In order to ask questions about a patient's cultural beliefs and practices in a non-judgmental way, the acronym LEARN can be used. L is for listening to the patient for the explanation of an illness from the patient's perspective. E is to elicit what the patient uses to help with the condition. A is to ask about other actions the patient might take to help with the condition. R is for respond regarding information about the biomedical model and recommend a plan of care. N is negotiate with the patient a plan of care that integrates both a culturally and biomedical model that is directed towards a goal that the patient approves of. The older Mexican American population is also more likely to attend church and have contact with their children daily. It is essential for nurses to help the older adult population make ties with their country, which will help build the patient's self-esteem and feelings of belonging. Nursing care for the community. The care of patients within the community can be complex, integrating a need for high-level nursing skills. It is important for community nurses to perform a cultural assessment because an individual's culture, along with other factors, determine what actions they will take to maintain their health status, how they will care for not only themselves but for others who are sick, and where they will go in order to obtain health care. A community cultural assessment involves collecting data, interpreting the data, and then identifying as well as implementing intervention activities that benefit the health of the community. In 2005, it was estimated that 11 million undocumented immigrants live in the United States, and of those 6 million are from Mexico. Undocumented immigrants face problems with accessing health care, such as lack of health insurance, language barriers, lack of knowledge regarding health services, and the fear that they could go to jail or be deported if they seek health care. For health education, Mexican Americans feel more comfortable when the location that is providing the education is at a familiar location. Therefore, as a community nurse, it is essential that educational classes are given in places such as churches so that more people will be involved in these important classes. In order to provide culturally sensitive care, nurses must understand the culture's most common beliefs and practices, as well as know how to care for a particular culture throughout the lifespan. Nurses must also be able to complete a cultural assessment to determine the needs of the patient and be able to incorporate those needs within the plan of care. For the Mexican American culture, it is important to understand that traditional practices may be used, and it is our job as nurses to ask patients what practices they use in order to treat their illnesses. Demonstrating knowledge and respect for Mexican American beliefs and practices will gain trust and an alliance with healthcare providers that will ultimately improve health outcomes. Nurses must also understand that we must treat patients individually and not group patients together. Just because they have some of the same cultural beliefs and practices does not mean that there will not be differences within one cultural group. To decrease health disparities as well as provide excellent quality care, nurses must continuously learn about different cultures so that culturally competent care can be provided at all times.